many of the problems in healthcare today focused on the cost of care and on the issues of poor quality of care deal with the difficulties with collaboration, coordination of care, communication among physicians. The Health Information Exchange is a very user-friendly tool for accommodating that coordination of care, providing information that's needed at the point of care for physicians, and then allowing them to communicate well with other physicians. It's unique primarily because this is an HIE that has grown up out of a physician group. Most HIEs have been developed from the technical side and then taken to physicians to use and try to apply in their daily practice. We as a physician group developed Sandlot Solutions, and because of that it's developed with the physician in mind, making it easy to use, making it something that's easy to adopt and implement, and fits right into our workflows on a daily basis. It minimizes the steps we have to take to get the information about the patients that we're caring for. If you're going to do an ACO, you've got to be able to manage the cost, and at the same time, to benefit from the cost savings, you have to prove that you're meeting a whole series of quality measures as well. I would argue that it's almost impossible to do that for most organizations without an infrastructure like an HIE to help you and facilitate that process, not only in the cost savings, but monitoring the quality of care. What we've done with Sandlot Solutions is a decision support tool that's based on top of that warehouse of data that allows us to feed to the physician at the time of care some decision support that allows them to know when they need to do preventative care or when they need to do tests that are recommended by many of the quality measures that are out there within the ACO. You know, in December when Dr. Berwick stepped down as director of the Center for Medicare and Medicaid Services, he said that most of the waste in our system comes from poor coordination of care, the poor communication among physicians, the inability of us to communicate efficiently together, and those costs are essentially addressed by the issues that of an HIE, the ability to pull information from all across the community into a single patient-centric electronic health record that is available to each physician irrespective of the site of service. It allows then the physician to be more efficient and to reduce a tremendous amount of waste that's sort of built into the system when we fail to follow the appropriate guidelines and processes, or we fail to coordinate the care of a very complex patient with the other physicians that are in the community.